Hello there, my name's Dr. Lane.
Hi, Dr. Lane.
Hello there, I've got Jenny down to discuss today, is that right?
That's right, my daughter Jenny, yes.
Excellent. Can I just ask you to confirm Jenny's date of birth for me before we continue?
Yep, it's the 10th of September 2024.
That's brilliant. How can we help with Jenny today?
Well, nice quick consultation really, Dr. Lane. I just need some antibiotics for Jenny. So we're going away to Mauritius for my brother's wedding in a couple of months. And I'm a bit worried. She was a bit poorly last month, and I'd really just like some antibiotics to take out there with me just in case that happens again.
Okay. You said that she was quite poorly recently, is that right? Is she
Yeah.
better?
Yes, thank goodness. She's a lot better now. Thank you.
Okay. Do you mind me asking what happened?
Yeah, so she started with a bit of a cough and cold, didn't think much of it, and then she went off of milk, which is not like Jenny. And then she seemed to be having trouble with the breathing. She got a little bit more laboured. So I brought her down here. So a lovely doctor, Dr. Ruby, I think it was, and she acted very quickly, very good, and got her straight into the paediatric ward where bless her, she needed oxygen, and she was in for about 24 hours. And the paediatric doctor said, oh, they think it was bronchiolitis. But yeah, luckily she got better with the oxygen and came home. And I thought, well, do you know, I'm going to post this on Mumsnet and I'm going to make people aware of it, because I wasn't aware of it. I didn't know anything about it. And then all the mums on there did actually say, well, I think she probably should have been given some antibiotics, then she wouldn't have become so poorly. And I wasn't aware of this because she didn't actually have any antibiotics. But you know, now I know. I think if it started again, I'd know to get them early in so she wouldn't get so poorly again.
Okay, well, gosh, I mean, I'm sorry to hear about that experience. That sounds
Thank
like it
you.
was quite
Very
quite
traumatic.
traumatic. Yeah, okay. How are you kind of feeling with things after all that?
I'm better now. I've done my own sort of research and reading, and spoke to a lot of the other mums out there. I think they've been a good support to me, and I'm aware now of much more of the signs and things to look out for and what I need to be asking for.
Okay, okay. Well, it's nice that you've got that support. That's always a good thing. Before we talk about that, do you mind if I just ask a little bit more? How's your little one doing at the moment?
She's thriving very, very well, thank you.
Brilliant. Okay, she's not had any further issues with coughs, colds?
No, not at the minute, thank you.
No, and her breathing seems okay.
Yeah, breathing's
Feeding
fine.
well.
Very well.
Brilliant. And just a few quick questions. Were there any issues around her birth at all that you're aware of?
No, natural birth, and she was born at term. Yeah, all very smooth.
Brilliant. She didn't have to stay in hospital or anything after she was born.
No.
Didn't have any problems with her breathing at
No,
that point. Okay.
nothing.
And how long away is this wedding?
A couple of months now.
Okay, brilliant. And I noticed that you're booked in for vaccination soon. Is that right, for the travel vaccines with the nurse?
Next week, we're all the families booked in.
Okay. And obviously you're saying that you're quite keen to get antibiotics before you go out there. Was there a reason that you're wanting it kind of before you travel rather than when you're there if needed?
Yeah, well, it's Mauritius we're going to, and I don't think the healthcare is going to quite be what it is here. So, and obviously with the language barrier as well, you know, they may not understand what my concerns are and Jenny's history. So I thought if I had some to take out, as soon as I saw if she was starting with those same things again, I could give her what she needed to be given.
Right, okay. So you're concerned that you might just not have access to the healthcare out there. Is that correct?
Yeah,
Okay.
exactly.
Is that something you've done any reading about or spoken to anyone about?
No, not really. I haven't,
Okay.
in all honesty.
Okay. And just wanted to check, has Jenny got any allergies that we need to be aware of?
No.
Okay. And do you mind me asking who lives at home with you and Jenny?
Me and my husband as well.
Okay. Do either of you have any issues with breathing or any past problems with breathing that you're aware of?
No, nothing.
Okay. And do either one of you smoke?
No, we're very fit and active.
Okay. That sounds brilliant. Well, I'll go through things if I may. We'll go through some of the options and then we can hopefully try and find the best way forward for Jenny whilst going out there.
Fantastic.
You mentioned about antibiotics. Now, what can be difficult is that not all infections can be treated with antibiotics. Now, you've mentioned obviously that, you posted online and the mums were saying that antibiotics might have been a good idea. But I don't know if anyone went through with you in the hospital, but bronchiolitis is actually caused by a virus. And viruses don't actually respond to antibiotics. Antibiotics don't help with viral infections at all, which is why you mentioned that she wasn't given any antibiotics while she was in hospital, and that's the reason why. So actually giving antibiotics for bronchiolitis would actually make no difference whatsoever. It won't change the outcome and it won't help Jenny get better any sooner.
Okay.
I know that people at Mumsnet have mentioned that being the case, but unfortunately, I think in this instance, they're probably not, they're definitely not correct.
Right.
So the hazards or the dangers of us giving antibiotics before you go out there is that you might start antibiotics for when she has problems with her breathing or her chest. But what if it is actually viral? What if it's something completely different? And actually, we're not only not treating it with antibiotics, but we're delaying her actually getting the help that she might need. We would always advocate that you go and see a doctor or a health professional when you're actually out there, so that they can actually make a proper assessment and they can work out what's the best course of action that's needed. Is it antibiotics, or is it like in Jenny's case that she needed to go to hospital and she needed to have oxygen, she needed to have extra help and support? Now, I know you've mentioned about healthcare and getting access to healthcare and you're worried about that. One option around this might be to actually either have a discussion with a hotel, which you could ring in advance, and normally most hotels will have someone who can speak English, or alternatively, if you're not confident going down that route, the other option is to speak to the travel company that you've booked this with. They will have people that might be able to let you know what the healthcare situation is actually like where you're going, and whether there is actually access to healthcare services. And a lot of hotels will have access to doctors that can speak English. And then, that might be a much safer way, because the last thing I'd want to do is give antibiotics only to find out that Jenny becomes poorly. We give her antibiotics and actually either it might not be the right antibiotics if she's picked up certain infections that needs different antibiotics, or it might be a viral infection that by us giving antibiotics, not only are we not helping, but we could actually be delaying her getting the help that she actually needs to get better. How do you feel about all that?
Yeah, I must say I was very keen to get the antibiotics, but now you've mentioned it, and if it definitely wouldn't have been appropriate in Jenny's case anyway, then it's probably safer that she gets checked out, isn't it, really, than me trying to just treat her with the tablets.
Absolutely. I mean, it sounds like you've been through a very harrowing experience, and the last thing we'd want to have is add more unnecessary experiences by treating the wrong thing or just treating Jenny inappropriately, So ideally, that would be the best course of action.
Okay, yeah. Well, what I'll do, I'll speak to my brother and go to the hotel and have a chat and see what's available through there. I mean, it's a very nice posh hotel, so I'm sure they'll know what's going on.
Absolutely. And the other options, you could just have a chat with your brother. He might know about the local services as well. He might know of someone and know of access to the healthcare system out there.
Yeah, of course. Okay, well, thank you very much, Dr. Lane.
That's all right, not a problem. Obviously, if anything changes before you go, you have any concerns or her breathing gets worse, if she catches anything, obviously do get back in touch with us.
Will do. Thank you.
That's all right, no problem. Bye for now.
Bye-bye.
Welcome everyone to the marking section for the prophylactic antibiotic request case number 92. Thought it might be helpful for me to quickly go through how I would mark this case, highlighting some of the key positives and key negatives that we came across. I think overall we can agree that the doctor did very well here. And certainly from a data gathering and diagnosis point of view, the vast majority of data was gathered. Specifically, the psychological impact and psychosocial context of what was going on was heavily investigated by the doctor. They did consider key red flags, and they had a structured and informed approach to problem solving. They also used existing information and clearly arrived at the right hypothesis here. The only negative I would say is that the doctor didn't really ask about the immunisation or past medical history in great detail, specifically not looking at things like developmental milestones to see if there might be some underlying conditions that we might be missing. So I might put that down as a negative for data gathering. In terms of clinical management, we can see again that the doctor did really well here, managing to hit most things. They did not prescribe the medication, which was the right course of action. They were safe and the management was appropriate and reflective of best current practice. There was adequate arrangements made for safe, sensible follow-up and safety netting, and in addition, we could confidently say the management plan was complete. The only slight issue, perhaps, is if we look here, we didn't really discuss about preventative measures, good hygiene practice, or really promote much understanding about when to seek medical attention. So I'll mark that down as a cross. Lastly, when it comes to relating to others, we can see that the doctor did exceptionally well, and I would argue that they hit all the markers here. They definitely explored the patient's agendas, beliefs, and preferences. There was a lot of respect and sensitivity shown to a mum's viewpoints. There was a good, clear explanation, and there was definitely ethical awareness shown about prescribing unnecessary antibiotics. Really importantly here, the doctor wasn't judgmental. They took on board that the patient was upset and this was traumatic for them, and the patient's just gone online to seek advice in the best way that they know how. There was good negotiation regarding the health belief and behaviours, and we reached a shared understanding with the patient, and we definitely showed an ability to communicate in a patient-centred way. So overall, we'll give ourselves a clear pass for relating to others, a clear pass for clinical management, and lastly, a clear pass for data gathering and diagnosis.